Over the last several weeks, I've been releasing videos about my difficulty with inserting my tracheostomy tube and also the pain I've been having with my tracheostomy tube. Now, many people have reached out to me and encouraged me and also have given me tips and suggestions either to clinics or to specific doctors. And I sincerely thank each and every one who did this. Unfortunately, some of the doctors and some of the clinics did not work out. Some of the doctors were not accepting new patients. The only way you could get in to see them is if you were in the hospital and then you had a hospital referral to see the doctor while you were inpatient in the hospital. So that's pretty much out. Some of the other doctors and clinics did not accept my insurance, so they're out. And some of the other doctors and clinics were not accepting new patients. Now, one particular clinic someone referred me to sounded like a great clinic. I'm not going to tell you the name of the clinic because I do not want to cause embarrassment or any humiliation to this person, because I really do sincerely thank the person for the referral, but I'm just going to share things that happened because this was a wild ride. This was a wild ride for trying to get into a clinic. So let me take you back to the start. So first of all, I'm given the name of this clinic. So I look up online the clinic and they have different departments. So there's ear, nose, and throat, but then there's many subcategories. I'm not sure which subcategory I'm supposed to go to, but I see that there's a general ear, nose, and throat clinic. And I think, well, let's start there because maybe they know who I'm supposed to be seen by. And let's just start general and try to get a little bit more specific. So I call up the general ear, nose, and throat clinic. I talk to the person there and the person says, oh, what's your issue? And I said, oh, I have a tracheostomy tube and I'm having a lot of pain and difficulty inserting the tracheostomy tube. Is there someone there at your ear, nose, and throat clinic that I can see? And the person goes, oh, you have a tracheostomy tube. We don't really do that here in the general ENT clinic. You're going to need to see somebody in the voice disorders and airway management departments. So here's their number. You can call over there and I'm sure they can help you out. So I hang up the phone. Next, I dial the voice disorders and airway management department. I speak to a receptionist and I tell her, hello, yes, I'm having some pain with my tracheostomy tube. It's very difficult to insert the tracheostomy tube. Is there a doctor there that I could see that could look at my trachea and to take a look at the tracheostomy tube? And I'm told by the receptionist, we're really busy here. It's going to be a while to see a doctor, but we can get you in to see a nurse. Now, if you bring in your tracheostomy tube with you, we could probably get you in next week and the nurse can change out that tracheostomy tube for you. And I said, I'm sorry, I was not very clear. No, I've had a tracheostomy tube for a very long time. I do my own tracheostomy tube exchanges. I'm just having a lot of difficulty. My trachea is very, very sore. And then also it's very difficult to insert a new tracheostomy tube. I don't need my tracheostomy tube exchanged out. I just need somebody to look at that. I need a doctor to look at the tracheostomy tube site and possibly take out the tracheostomy tube, look down there, see if there's any granulation tissue or anything like that, and just look at the area and let me know why it's so difficult to change out my tracheostomy tube and why I'm having so much pain. The receptionist goes, oh, you need somebody to actually look at your airway. Whew. Well, you see, our department really doesn't do tracheostomy tubes. You need to go to head and neck surgery. They will be able to help you out with a tracheostomy tube complication. Okay, are you ready? I can give you the number. So the receptionist gives me the number to the head and neck surgery center. So I hang up the phone and then I call the head and neck surgery center. Just a little bit of a note for here that the head and neck surgery center is not under ear, nose, and throat. I have now switched to oncology. This is part of the cancer center. So I call up the head and neck surgery center and I say, hello, yes, I have a tracheostomy tube. I'm having a lot of pain with my tracheostomy tube. And I was wondering if I could see a doctor that they could look at my tracheostomy tube area, evaluate it, and let me know why I'm having so much pain. The receptionist goes, yes, well, what is your cancer diagnosis? And I said, no, praise the Lord. I don't have cancer. Praise the Lord. I don't have cancer. And he goes, well, what has your previous cancer diagnosis been? And I said, no, my apologies. I've never had cancer. No, I don't have cancer. And then he says, well, why do you have a tracheostomy tube? I said, I have respiratory failure and I need a ventilator attached to my tracheostomy tube to move air in and out of my airways. And he goes, oh, so you have a ventilator, like life support? And I said, yeah, ventilator, life support. That's what I have. And he says, oh, no, we don't deal with that. You're going to have to go and call critical care. Would you like the number? And I said, yes, please. I like the number for critical care. So I take down the number and hang up the phone with head and neck surgery. And up next, we are calling critical care. So I call critical care and I talked to the receptionist and I said, hello, yes, I'm having a lot of pain with my tracheostomy tube. It's becoming very difficult to change out my tracheostomy tube. I called over to ear, nose, and throat, and now through everything, I've been referred off here to critical care. They said because I have a ventilator, I need to see critical care. I was told, and who is your pulmonologist? Because we really need to get a referral, and I'll just look up your pulmonologist and send over a little form your pulmonologist can fill out so we can get that referral set up. I said, okay, my doctor is Dr. So-and-so. And so I wait a while, and then the receptionist comes back. I'm not finding that doctor in the system. Can you give me a little bit more information? And I said, oh, if you're just looking in your internal system, my pulmonologist is not part of your medical center. He's in a different medical center, a different city. I hope that's not an issue. And then she goes, yeah, well, we really need to be, you need to be referred by the pulmonology department, and we do not take external referrals. We're going to have to get you over to the pulmonology department here at this medical center. And if they want you to see critical care, they're going to have to refer you over here to critical care. Do you need the pulmonology department's number? And I said, yes, I do. I do need the pulmonologist's number. So I take down the number. And then I hang up the phone, and now we are calling the pulmonology department. So, pulmonology department. And I say, hello, yes, I have a tracheostomy tube, and I'm having a lot of pain with my tracheostomy tube. I'm also having difficulty changing out my tracheostomy tube. I called over to the ear, nose, and throat clinic. They said they couldn't help me. I got referred over to critical care because I have a ventilator. They said critical care needs to help me. Critical care says I can't see them without getting an internal pulmonology referral. So now I'm just calling over to your clinic. Is there a pulmonologist I can see to get a referral to critical care? So hopefully I can get this tracheostomy tube issue resolved. And I'm told, oh, yes, well, you are calling the right department. We are the pulmonology department. Okay, well, you said you had a ventilator now. What kind of sleep apnea do you have? I said, oh, no, I don't have sleep apnea. I have a genetic condition called mitochondrial disease that has caused respiratory failure. And due to the respiratory failure, I had to get a tracheostomy tube and ventilator. And then the receptionist goes, I see. Well, that sounds really complicated. And because you have a genetic condition, we are going to require a referral from genetics. So are you ready? We're going to give you that number for genetics. You can call over there and get everything sorted, and they can refer you back over to us. I said, yes, great. Genetics, I don't have their phone number. I'm ready for that phone number. Okay. Well, thank you so much. Click. So now I get to call the genetics department. So I call the genetics department and I say, hello, yes, I'm having a lot of pain with my tracheostomy tube. I'm also having difficulty inserting it. I called the ear, nose, and throat doctor. They said because I use a ventilator, they can't help me. I had to get referred over to critical care. Critical care said they can't help me because they need an internal referral from the pulmonology department. I was given the pulmonology department's number. I called them and they said, unfortunately, because I need a ventilator and a tracheostomy tube because I have a genetic condition called mitochondrial disease, they can't help me because they need to be referred from the genetics department. So I'm just calling up. I just need to see somebody in the genetics department so I can get referred to pulmonology. So pulmonology can refer me over to critical care, and critical care can either work with head and neck surgery or go to ear, nose, and throat or do something. But that's how I just need some referrals, just need some referrals. And I get the loveliest reception. Yes. Thank you for calling the genetics department. I see. Yes. Well, we also need a referral. We're going to need your primary care provider to write us out a referral. Once we receive that referral, and then we're going to need all your medical records. And I said, I hate to interject. I don't really need a diagnosis. I just need my tracheostomy tube looked at. That's just the receptionist goes on. Well, yes, but I didn't finish. Okay, so then once we get your medical records, it's 4 to 6 months before someone will review them. After 4 to 6 months, we will decide if you are going to be accepted by our clinic. I would like to tell you 1 in every 7 patients is accepted in our clinic. We are very busy and we are very selective. So just letting you know, it's going to be 4 to 6 months. Once we get those medical records, then we'll decide if we're going to accept you as a patient. I was like, oh, that's great. I really just need to see somebody from my tracheostomy tube. I don't really need my medical records reviewed. I don't need a diagnosis. I have been diagnosed by several major medical institutes, and I even saw probably the top expert in mitochondrial disease, and my diagnosis was confirmed by that doctor. So I don't really even need to see someone in genetics for my mitochondrial disease. I'm not looking for a diagnosis. I just need a referral to see the pulmonology department so I can see critical care, so critical care can work with somebody with my tracheostomy tube. I'm just not trying to be difficult or anything, but I really don't need a full review of my medical records. Yes. Well, that's not how we work here. You're going to have to send us all your medical records and a referral from your primary care provider. And if we decide we are going to accept you as a patient, it is another 7 to 8 months before we have another available appointment. And then once one of our doctors sees you, we will decide who should be on your team. If you need to see pulmonology, we will refer you to pulmonology. But if not, we won't. And I was like, lovely. Thank you. Thank you so much. I really do appreciate all your help. And, if I want to get this process started, just can I get that fax number? Where do I need to have my medical records sent? And where do I need to have my primary care provider to send that referral? Okay. Well, great. Thank you. It's just been such a pleasure. Thank you so much for all the information. I do appreciate it. Okay. Bye-bye. That was my interaction with that clinic. It was exciting. So you're thinking, 4 to 6 months for review of medical records, and then another 7 months, 8 months to get an appointment. Yeah, we're looking at about a year, maybe longer. Plus I need to see my primary care provider. And plus you have to get all the medical records. I just don't think that clinic's going to work for me because let's face it, I don't really need genetics. I don't need a full genetic workup. I've had a full genetic workup. I know what I have. I just need my tracheostomy tube looked at, and I really don't want to go through genetics and possibly any testing they want, and then perhaps getting referred to pulmonology, then perhaps getting referred to critical care. And I envision this is going to take 2, maybe 3 years to actually see the doctor I need to see. So, well, I do appreciate the person recommending this clinic. This clinic's not going to work. So the search continues to find somebody. But hey, time is ticking down. We're getting closer and closer to seeing my nurse practitioner with my pulmonologist, and time is ticking down. Closer and closer to actually see my pulmonologist, and maybe he can sort out some things. Or maybe he might be able to have that magic touch and know somebody at that other clinic and be like, hey, Bob, hey, remember me? We went to medical school. Yeah, I have a patient here. She has an issue with her tracheostomy tube. Can you sneak her in and see her? I always do hope for those courtesies and those kindnesses, because you never know. It's a small medical world and people do know each other. And sometimes you can kind of, I don't want to say usurp the circle, but find a shortcut through the medical system. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.